with a lesion in the right posterior parietal cortex might try to copy drawings, but the patient's ability to copy the left side of the drawings is severely impaired. Such a person will always try to avoid using his or her left arm, left hand, or other portions of his or her body for the performance of the tasks or even to wash this side of the body. And that is known as the personal neglect syndrome. So you can be asked about this condition. What is personal neglect syndrome? That if a person is having a lesion on one side of the parietal cortex, the person intentionally tries to avoid using that portion, the opposite side of that hand, arm, or portion of his body to perform the different tasks. So, almost not knowing that these parts of his or her body, they are existing. You can see the actual drawing and the patient's copy of drawing. Now, abnormalities or diseases of basal ganglia. They are broadly classified into hyperkinetic diseases and hypokinetic diseases. Now, hyperkinesis, what is it? It is actually that there is exaggeration or excessiveness in the voluntary movements. Then hypokinesis, what is it? There is decrease or slowness over there in the voluntary movements. Now, hyperkinetic diseases. Now, hyperkinetic diseases, what are they? They are like chorea, non-rhythmic, jerky, purposeless movements, especially in the hands, along with possibility of voluntary movements. The causes, the types, they are like Huntington's chorea. Huntington's chorea is autosomal dominant gene on chromosome number 4, and the onset is mostly in the middle age. There is presence of loss of most of the cell bodies of the gamma aminobutyric acid secreting neurons in the caudate nucleus and putamen, and of acetylcholine secreting neurons in many parts of the brain. Huntington's disease is a hereditary disorder which usually begins around the age of 30 to 40 years. And it is characterized at first by the flicking movements in individual muscles, and then they are going to be progressed to severe distortional movements of the entire body. In addition, there is presence of severe dementia developing along with the motor dysfunctions. Now, what are the signs and symptoms of these hyperkinetic diseases? There is chorea, there is irritability, there is dementia, fits, and ultimately even can lead to death, and the treatment is none except counseling. You can see. Then we have another condition, and what is that? That is the Sydenham's chorea. It is a rare complication of streptococcal infection. Now, lesion in the putamen, flicking movements of hands, face, and other body parts, and the onset is in childhood, and the dancing-like movements, they are there. You can see the dancing-like picture. Then Hemiballismus. Hemiballismus, the flailing movements of the entire limb. It is affecting the proximal muscles, and it happens due to the vascular lesion of the subthalamic nucleus, usually in elderly diabetic patients. And the recovery is spontaneous or over months. Then we have IdiPtosis, slow, purposeless, spontaneous rhythmic movements, especially over there in the digits, hands, face, tongue. and they are quite difficult to distinguish from chorea. Lesion is at the level of globus pallidus and it is absent during sleep. The causes can be perinatal hypoxia. It can be kernicterus. What is kernicterus? That is the accumulation of elevated levels of bilirubin in the body. When this bilirubin gets deposited over there in the gray matter of the brain, it can lead to kernicterus and IdiPtosis can develop. Then there is another disease which is very important, and what is it? That is the Wilson's disease. Now, Wilson's disease is one of the beautiful examples of autosomal recessive inherited disorder, and it occurs as a result of chromosome number 13 involvement. Now, what happens is that there is deposition of copper over there in the liver and brain. And mostly it is there in the females. You can see that it is 4 times more common in female than men around 6 to 20 years of age. There is cellular degeneration of putamen. Now, signs and symptoms: the children present with hepatic problems, whereas adults they present with neurological disease. There is presence of tremors in the body, there is difficulty in speaking, which is dysarthria, there is a problem of forgetting things, dementia, there is presence of a ring sort of appearance in the cornea known as the Kayser-Fletcher ring. Then there is jaundice, there is fatigue, there is weakness, and lifelong penicillamine, which is the antidote for copper that is to be taken, and if the liver is very much involved, the liver transplant is the treatment. Then we have the hypokinetic diseases, Parkinsonism, also known as Parkinson's disease, also known as paralysis agitans. It results from widespread destruction of that portion of substantia nigra that sends the dopamine secreting nerve fibers to caudate nucleus and putamen. So you can see that there is depletion of dopamine from the dopamine secreting nerve fibers of substantia nigra. The general attire of Parkinsonism suffering patient. Now, the pathophysiology: the dopamine secreted in the caudate nucleus and putamen is actually the inhibitory neurotransmitter. Destruction of the dopaminergic neurons in the substantia nigra of the patient occurs, and it can lead to the overactivity of the caudate nucleus and putamen, and it causes continuous output of excitatory signals to the corticospinal motor control system. These signals could overly excite many or all of the muscles of the body, thus leading to rigidity. Some of the feedback circuits might easily oscillate because of loss of their inhibition, that is, tremor of Parkinsonism.